One of the Sustainable Development Goals is access to health, and the provision of such services remain every child's right. Despite the existence of this right, Health and Childcare Minister Dr. Obadiah Moyo says his ministry encourages children to discuss reproductive health issues with their parents. There's been a debate on the distribution of condoms to school children, and the argument has been that it encourages promiscuity among children.
Every citizen of Zimbabwe is allowed access to a health institution in Zimbabwe. So anyone can access a healthcare center. However, for children who want to go to hospitals in relation to reproductive issues, we always recommend and say that it is advisable for children to discuss with their guardians if they fear to discuss these issues with their parents. And if they have conditions which are very confidential, yes, guardians would play a very, very major role. You know, we don't want to encourage someone who's contracted a sexually transmitted infection to just come to the hospital and without having to advise their parents.
UNICEF country representative Ms. Leili Moshiri says her organization is committed to continued partnership for the good of future generations.
We look forward to working with you to implement your agenda for the year. For this year, it is also important to take note that the Convention on the Rights of the Child marks its 30th anniversary in November, and we are pleased to have spent some time with the junior parliamentarians in the past week to discuss where we are in the implementation of the Convention in Zimbabwe.
The Day of the African Child is celebrated on the 16th of June in commemoration of this 1976 Soweto uprising in South Africa, where children stood for their rights and fought to emancipate themselves from discrimination. Kudzai Gumbo, ZBC News, Harare.